What if my wife was pregnant and she was talking about wanting to do a detox? Is it safe for her?
No,
Okay.
it is not. Because again, you have to find out, one, what area of the body's stressing, and two, if you're detoxing, you don't want to push those toxins into the baby.
That makes sense.
Or you don't want to wait till after you have the baby either, because if you're breastfeeding, those toxins and things that you're going to be doing are going to go pass through the breast milk. So there are certain herbs that you cannot use while you are pregnant or nursing, and so having a nutritional consult at that point in time will determine the safety factor of being able to do a detox or not.
Earlier, you and I were talking about nutritional wellness, and I had mentioned pregnancy to you also, and you said that is in a category in and of itself, and now I understand why. Is that makes sense. So if somebody is thinking about getting pregnant, is there a difference between thinking about getting pregnant and pregnancy itself as far as creating a nutritional plan for having a baby?
Yes. If it comes down to if the person's infertile or not. That is a hormone balancing program. If it's just somebody that wants to get pregnant and not having hormonal issues, but they just want to make sure that they're as healthy as they can be, then definitely being able to detox properly, rebuild the body properly, and have the body ready to go into pregnancy is very important as well. After a lot of people, what they'll do is they'll say, oh, I'm taking a prenatal.
Right.
Well, most prenatals that are prescribed for them are usually synthetic.
Okay.
They're not a whole food vitamin. So again, you're getting a petroleum-based vitamin that's been prescribed that now takes more chemistry for you to get rid of the body than to be able to utilize it. And it's very similar. You want a whole food substance like an apple and get all the nutrition that you can from the apple, or do you want a TV dinner?
Oh, that makes sense.
So those are the differences when you are choosing your prenatals to, one, either prepare to have a baby, or two, when you are pregnant, making sure you have a good whole food vitamin that's feeding that body, not a TV dinner.
I noticed a sign in your office that said something to the effect that if a doctor tells you to stop taking medications because you're pregnant, what makes it healthy for you when you're not pregnant? And I found that fascinating. What's your take on, obviously you like the message that sign delivers. Why do you have that sign hanging in your office?
Because most of my patients that are on medications, they're on one medication for one thing, but it has so many different side effects to it. Now they've got 4 other medications to deal with the side effects from the one. If you were pregnant, they wouldn't be on any of those medications, or they would be on very few, because they don't want to harm the baby. They don't know what those medications are going to do. If you look at the medications, they have a long list of side effects. So here you are, maybe you suffer from depression. So I'm going to give you this antidepressant, but you could have bloody noses, you could have suicidal attempts, you could have weight gain, you could have all these other lists of things that create more side effects than the one benefit that you're getting. When you look at nutrition and look at where the body's stressing and you fill in the gaps, not only are you giving the body a whole food that's going to help it repair itself, you're not chemically bound to that. You should be able to take the whole food supplement, rebuild your body, and get off of it.
That makes sense.
Most people are taking medications and then they're on it for life. Meanwhile, it's taxing the liver, it's taxing the kidneys, it's not safe for the baby, or if they want to get pregnant, it's not safe for even if they want to get pregnant. So to me, the more you can feed your body the good things, the body's smart, trust it. It knows how to rebuild it, you just got to give it its proper tools.
And that makes sense.
And that makes sense.
It makes sense. It does. If anybody had any questions about rebuilding their body, they would be able to contact the clinic and schedule an appointment?
Absolutely.
Oh, excellent. Thank you, Doc.
Mm-hmm.